This is 97.7 The Bolt, and we are in the Humboldt County Memorial Hospital, Your Care, Our Mission show, and I am joined now by Jack from the hospital, and he is going to talk a little bit about what he does at the hospital. I know that you kind of explained it to me, but it's a little too early for me, so if you just want to explain it yourself to our listeners.
Sure. My name is Jack Dorn, and I'm a physical therapist at Humboldt County Memorial Hospital. I have been here for a little over 3 years now. I previous had worked as a physical therapist for over 20 years in the Springfield, Branson, Missouri area. Our rehab department is really growing in leaps and bounds the past 3 years. In that time, we have added 3 additional physical therapists, 2 additional occupational therapists, a new physical therapy assistant, an occupational therapy assistant, and a rehab tech. And we're also in the process of hiring more additional staff due to our continued growth in our rehab department. So we're really growing a lot. Our therapists are continually going to conferences and seminars to learn the newest techniques and procedures for a wide variety of diagnoses that we are seeing in the outpatient clinic and in the hospital itself. One area that I have received special training in is a certified vestibular therapist, which I received at the Dizzy Institute of America in Largo, Florida. As a certified vestibular therapist, I can assist in the diagnosis of people who are having dizziness, vertigo spells, where a person feels like the world is spinning and they cannot stand up straight or upright, and can even cause nausea and vomiting at times. The most important thing with dizziness and vertigo is to diagnose it correctly, so you can treat it correctly. Once properly diagnosed, the treatment can many times be very easy, and a person can have a very fast recovery from their symptoms. The most common diagnosis of vestibular issues is what they call BPPV. The big words for that are benign paroxysmal positional vertigo. It's where you feel like the room is spinning. You may feel, people call this that their rocks are out of their head in their inner ear. That's the typical thing. And it typically happens when people are rolling in bed, getting up in the morning, or turning their head quickly. When a person comes in with dizziness or vertigo to the clinic, I will take them through an assessment to determine the problem. And if it is the BPPV, or the rocks in the inner ears, then there is a maneuver I can take a client through that will help clear these rocks, which are actually called calcium carbonate crystals that our body naturally produces in our inner ears, out of what they call the semicircular canals in our inner ears, which there are 3 of them. They usually take 1 to 4 treatments to accomplish this, depending on the severity and the length of time the client has had these symptoms. But BPPV is not the only vestibular dysfunction or problem that can cause dizziness or vertigo or the room to be spinning on you. Other examples are maybe vestibular neuritis, which is kind of an infection of the inner ear, Meniere's disease, vestibular hypofunction, among other problems, which all require different treatment techniques to achieve the desired results with therapy. That is why diagnosing the problem with a client's dizziness is so important. And you want to find someone that's been specially trained in this area to do so. So that way the correct treatment path can be taken to fix the problem. If you are having any problems with dizziness or vertigo symptoms, especially if you get dizzy rolling in and out of bed, turning your head in the car, looking up at a shelf, turning your head when you're shopping, all you have to do is call your physician so they can contact our outpatient therapy department to schedule an appointment. Insurances cover these appointments, and the appointments usually last about an hour. And again, if it is a certain problem, they can only 3 to 4 treatments. A lot of times we can get rid of all the symptoms and problems that they're having. So that's kind of, in a nutshell, that's vestibular therapy. So,
All right, we are going to take a quick break, and we will be back to talk with Jack from the Humboldt County Memorial Hospital on the Your Care, Our Mission show on 97.7 The Bolt.
Stay close to home and save on time and travels with test procedures done right here at Humboldt County Memorial Hospital. HCMH provides diagnostic mammograms right here in Humboldt. They have a radiologist specializing in breast health now on site every Thursday morning. For more information, call 332-7663. Enjoy the convenience of having your procedures done locally. The choice is yours. Call Humboldt County Memorial Hospital at 332-4200. That's 332-4200. Or go online at www.humboldthospital.org to find out more information about the diagnostic testing and many procedures offered at Humboldt County Memorial Hospital for quality care close to home.
This is 97.7 The Bolt. We are in the Humboldt County Memorial Hospital, Your Care, Our Mission show, and I am joined by Jack. He is a physical therapist at the hospital. We just kind of talked a little bit about what he does to help you guys out, and now the Humboldt County Memorial Hospital is going to have a medical equipment drive. Do you want to tell us a little bit about that, Jack?
Sure, yeah. Basically what that is in town, if you've had a medical illness or problem and you have any medical equipment that you had been using but don't currently need to use anymore, we're acting that you loan that into what they call the loan closet we have here in town. It's right downtown on 601 First Avenue South at the corner of First and Taft Street. And on Thursday, July 9th, from 1 to 4 p.m. in the afternoon, any medical equipment you may have, such as shower chairs, shower benches, toilet risers, walkers, canes, crutches, hospital beds, reachers, sock aids, etc., that you're not currently using, they ask if you can bring it down to the loan closet on that day, and then other people that would need that equipment for a short period of time to use after they're going through their rehab or getting over a problem they've been hospitalized for, they can utilize, and several people can utilize that equipment.
Yep.
Of course, it's all free. They appreciate all the donations, and again, that's going to be Thursday, July 9th from 1 to 4 p.m. You can just drop your equipment off, the items there. There'll be people to take it from you, and I'm sure someone will use it and greatly appreciate it. So that's our next thing coming up.
Yeah, all right. Do you have anything else that you would like to mention, Jack?
No, I don't think so. Like any medical equipment, you have pain, illnesses, weaknesses, dizziness, etc. Just we're happy to see you in our outpatient clinic. We'll give you great care, and I appreciate the time.
All right, and if you have any questions about anything going on at the hospital ever, give them a call at 332-4200. That's the number to call and ask them all of your questions that you have. And join us back here next week for the Humboldt County Memorial Hospital, Your Care, Our Mission show on 97.7 The Bolt. Thank you.
Thank you.